God's Love We Deliver is the leading provider of medically tailored meals in New York City's metropolitan area. What we do is we cook and home deliver meals that are individually tailored for people who are so sick that they can't shop or cook for themselves. We've been doing this for 32 years. We got started at the height of the AIDS pandemic when people were alone and isolated and were starving. And some very, very courageous people decided that they had to go to other people's homes and make sure that they got fed. From that experience, we learned a lot about providing meals to people who are really, really sick. And so in 2001, we expanded our mission to serve people with all life-threatening illnesses. And today we serve people with an expanded array of diagnoses, from cancer to COPD to cardiovascular disease, end-stage renal disease, and hundreds more. We believe that food is love and that food is medicine. And the research and our 3 decades plus of experience really bear that out. So our clients, who are they? When our clients come to us, they are people who are the highest risk, highest need, highest cost people in the healthcare system. They're people who use the hospitals a lot, people who use emergency rooms a lot, people who really are living with severe and chronic illness. 90% of our clients live at or below the poverty level. 90% report more than one critical diagnosis. Many on top of that report 3 or more. About half of our clients report to us that they have behavioral health issues. And this whole combination of symptoms and diagnoses is what leads them to go to the hospital a lot, to count on emergency rooms and emergency departments, and really to be the small fraction of people who really cost the system the most. What our registered dietitian nutritionists do, and there are 7 of them, is they do medical nutrition therapy that includes a really extensive intake and assessment process, where they figure out what our clients really need to benefit from this individualized medically tailored meal that we provide. We're the only choice for these super utilizers, because these are the people whose health is really making it difficult for them to take care of themselves. So not only are they unable to shop or cook, they really don't benefit from the other meal programs in the city because they're too generalized for them and they need something very specific. So our registered dietitian nutritionists figure out what is that specific meal that best meets their medical situation. Medically tailored meals lower healthcare costs, promote better healthcare outcomes, and improve patient satisfaction. And we do all of those things. Largely the patient satisfactions, we help people stay at home where they're comfortable and more at peace. But from a cost perspective, you can feed someone for a half a year for the same average cost as one night in a hospital. So for every night we save somebody from going to the hospital, that's a half a year of medically tailored home delivered meals. That's pretty remarkable, I think. From an outcomes perspective, we know that what we're doing leads to better results. So I'll give you a couple of research examples. We did a study with colleagues from the Columbia University Mailman School of Public Health with people who were food insecure, who had horrible markers of both mental health and medical health functioning. They also were not compliant with their treatment. They didn't keep doctor's appointments. They didn't take their medications. And when they got access to the food that they needed, all of those markers turned around. They became compliant with their treatment and medications. They relied much less on the emergency department. They were hospitalized less often. A woman, 97 years old, was very much at high risk of going to a nursing home because she was really not doing well. And by bringing her medically tailored meals and having her talk with our nutritionist more about how to manage the meals along with her medications, she was able to stay in her home and not go to the nursing home, where again, she's happier, but also she's doing better. And then a man with HIV who's 58 years old, who also has a severe blood clotting disorder, was able to get stabilized and have continuous, good, healthy blood results, stay in his home, and is now adherent to his medications and is staying actively engaged in treatment. So the bottom line is medically tailored home delivered meals save healthcare costs, improve healthcare outcomes, and lead to much happier and satisfied clients.